It's a real pleasure to welcome you all. Here we are at the Vermont Center on Behavior and Health's third annual conference on behavior and change and health disparities. And Dr. Higgins, thank you for inviting me again this year to share a few welcoming remarks. I'm always pleased to participate, even in a small way, even though I know you're doing the work. I want to recognize the outstanding commitment of our nation's top medical researchers. They're expanding and improving our public health and well-being. I talked to you last year, and I spoke of the growing epidemic of opioid abuse in Vermont. Unfortunately, that's an epidemic that we see in state after state across the country. But over the past several years, we've had real efforts in research. We've had the dedication of Governor Shumlin, the law enforcement community, and Vermont's medical community. Because of that, we've been able to put resources and great effort on education and awareness and treatment efforts for victims and their families. Now, over the next few days, you're going to discuss the effects of human behavior on individual health, especially as it relates to mental health, tobacco, and alcohol use, but other substance abuse. I'm really happy that this year's conference is going to explore ways in which we can improve mental health awareness and education across the community. We need this important conversation so we can move closer to breaking the destructive cycle of substance abuse. This cycle exacts a devastating toll on individual lives, on families, and often on our whole community. I'm also pleased this year's conference is going to address the health and social costs of obesity. I'm the senior-most member of the Senate Agriculture Committee, and I've long been committed to combating hunger and malnutrition and its relationship to obesity and diabetes. I know that far too many Vermont families struggle to put a healthy meal on the table each day. Now, we see, all of us see, how this causes many, including our children, to be undernourished. We all know that a hungry child cannot learn. It creates a vicious cycle. Over 20% of Vermonters suffer from obesity. 55,000 Vermonters are living with diabetes. In our state, even though we lead the nation year after year as one of the healthiest, these numbers show we have to do better in providing healthy food for struggling families. I've continually pushed for strong nutrition standards at school. That's why I continue to press for increased attention and resources for the Farm to School program. These kind of partnership initiatives, with those we're both expanding child health and nutrition education, but we're also supporting the livelihood of agriculture producers, not just in Vermont, but throughout the nation. Now, the dedication of researchers like you to advance medical knowledge is helping to bring about more effective answers to strengthen public health for generations to come, especially when you evaluate the connection between human behavior and trends in public health. When you do that, the medical research community is moving us closer to identifying solutions for lasting change. And I believe in the responsibility of the Congress, everybody in the Congress, to ensure that policy decisions reflect these life-saving and health-promoting advancements. For example, does anybody here argue we have to continue our investments in the National Institutes of Health and the Centers for Disease Control and Prevention? We want to ensure that our nation's top researchers have the resources they need to continue breaking new ground. It is actually part of our national security. We have to ensure that school nutrition standards reflect the advances in medical knowledge. It's also crucial for our law enforcement and our medical and our educational communities to remain united, work together in the fight to remedy and address substance abuse and mental health disorders. and I've seen throughout our state where they have worked together, and I'm proud of that. And I'll keep on supporting these important initiatives because your work is so, so important. Now, the conference, as you know, is going to focus on the major accomplishments of research and clinical efforts. These are invested in saving lives today, but also they promote the health of future generations. As a Vermonter, that means a lot to me. Your collective efforts have shown extraordinary promise. I know we're going to expect great and practical advances from each of you. So I'm grateful to Dr. Higgins. And I'm grateful to UVM's Vermont Center for Behavior and Health for inviting me to welcome you to the conference. Especially, I want to thank all of you for your tireless dedication to improving the lives of others. Best wishes for a very successful conference. Thank you.